Beautiful guy, might not be as fast as that cheetah, but even though he has one of his legs amputated, he is getting along just fine. This is Bear. He is a cancer survivor, thanks to Dr. Gerald Post, who is a veterinarian who specializes in cancer treatment. So I welcome Dr. Post and Bear's mom, Carol Ferrucci. And Bear, of course, is not only beautiful, but this is really an incredible survivor story. And thanks to you, Dr. Post, Bear is sitting with us today. So let's tell folks what happened with Bear.
So Bear is a 2.5-year survivor of osteosarcoma, which is a very common cancer of the bone in large and giant breed dogs. So after his tumor was removed, Bear was treated with chemotherapy, was doing really well, and then the cancer actually came back a year later, and then we treated him with another round of chemotherapy, and his metastatic disease actually went away, and now he's on some maintenance chemotherapy to keep the cancer away. So he is truly a miracle dog.
It's amazing, and it's amazing all the advances that we are making and continue to make to be able to help a dog like Bear, or even a cat. Do cats and dogs respond just as well?
They do. Both dogs and cats respond very differently to both chemotherapy, radiation therapy, immunotherapy than people do. And they respond differently because we make it so. We decrease the dosage, we increase the interval, because we have two pillars that we need to uphold in veterinary oncology. One is quantity of life, but the other is quality of life. And so we want them to feel great, both during the therapy as well as afterwards. And so they do amazingly well.
It's amazing. I mean, and it really is. And Mom, I guess when you found out, how did you find out that something was wrong with Bear? And obviously you must have been devastated when you heard what was wrong.
Oh, yes. What had happened is we have another dog, an Old English sheepdog, and they were wrestling out in the yard. And the Old English jumped on top of him, and we heard him scream. We brought him to the vets and learned, we thought his leg was broken. We brought him to a surgeon to see about putting his leg back together again.
Right.
And it was there we learned he had osteosarcoma.
Oh,
and that began our journey. Our house, we cried for 2 weeks.
But now, when we see Bear, you must be positively thrilled.
Oh, I couldn't be happier, and I'm really, really grateful for Dr. Post and his team. They've been very helpful and supportive.
It's wonderful, and again, it's wonderful the advances and what we can do and how we can help, and I guess how also you become involved as a physician.
We have a new center in Norwalk with both chemotherapy, radiation therapy, and access to clinical trials. And so when we guide people, we want to make sure that they have all of the options available. My own 2 dogs developed cancer, and I had all of the options in the world really available to me. And that's what our goal is to make sure people have all of those options, explain to them, and basically the best advice I can give anybody is what I would do for my own dog,
Absolutely.
What I would do for my pet. That could be doing treatment, and sometimes that could be doing very palliative or pain-relieving therapy.
And Doctor, I know you're involved in putting on the dog. You're also going to be involved in educational seminars, which I think is really interesting. And I know that our viewers would probably want to, get involved too. So where can they find you? Because I know people always have questions, and they really want to talk to the vet and get great feedback, which is what you give.
Sure. So there's 2 ways. One is through our website, which is www.vcchope.com, and the other is with our phone number, which is 203-838-6626.
And you're also involved in raising money for cancer care for animals. So
Correct.
You definitely give back. So thank you so much, Dr. Post, for being here. This is so great.
Well,
thank you, Carol. I'm so happy for you. As a pet mom, I understand, and Bear is just beautiful.